think the 1,000 Lives campaign is important for three reasons. Firstly, because it focuses on patient safety, which we know is a very important challenge for modern healthcare systems throughout the world. Secondly, because it puts a very strong focus on local clinical and managerial leadership for patient safety within NHS organisations, and we know that without strong visible leadership we won't succeed in improving patient safety. And thirdly, because it puts a very clear focus on implementation and working closely with frontline nurses and doctors and pharmacists and other healthcare staff to really look at how we embed safer practices in everyday clinical care. The campaign's been very successful at engaging frontline staff in its work, because I think the whole style of the campaign has been very much a collaborative partnership, and it's put a very strong focus on working closely with frontline staff on the development and implementation of the campaign interventions, but also I think it's created a sense of enthusiasm and excitement and possibility for frontline staff around what can be done to make care safer for patients. I think one of the things that the campaign approach has brought to patient safety is a level of energy and passion and excitement around how we can truly work together to make patient care as safe as possible. If a staff member asked me what they should do to keep their eye on the ball in patient safety, I'd say, think about what you can do tomorrow. What's the one practical step that you can do in your practice to make care safer for the patients that you care for? Of course, the wider environment of healthcare is important, and in a way I think it's a very dynamic environment and there will always be changes, but I think if we can really focus on, first of all, understanding that environment, but secondly then looking at what's possible for us to do in our frontline teams to really make care the best it can be. I think there's a lot that many other people and perhaps other countries can learn from the experience of Wales with the 1,000 Lives campaign. Firstly, I think is the importance of leadership at a system level, and the real sense, the palpable sense in Wales that this is a very important priority from the Welsh Assembly Government through to the front line of clinical care. Secondly, I think the fact that the campaign has created a platform for action and created a real sense of a critical mass of clinicians and other people in the healthcare system who are working together to improve safety. And I think thirdly, the fact that you have been in Wales very bold about and rightly put an emphasis on the importance of measuring what you're achieving and being open and transparent, both about the things that have been achieved as well as the things that are areas for continued improvement. There's no doubt that we face challenging times as we look ahead in the National Health Service in Wales, and what's going to be important, I think, is that this agenda around patient safety, this agenda around healthcare improvement is not the first thing that falls off the agenda when times get tight, but is really core to our response to having perhaps less resources in the system to deliver care. And I firmly believe that we can focus not only on improving care, but also using resources as efficiently and effectively as we can, and those two things can go hand in hand and can mean that we can continue to improve patient care across the NHS in Wales.